transformation when we talk about reconstructive surgery. I believe it's not just physical transformation, but there are those invisible scars, those deep emotional scars that are there. My question is that how do you as a doctor hold space for both?
So scars are very difficult. It's a very subjective how you deal or how the patient deals with the scar. So when you're treating a scar, you are not just treating the physical aspect, you're treating that emotional baggage they have been carrying for a long time.
Some of the challenges, I would say, or the hardest part of your job.
You see a lot of things in a hospital. A hospital is a slightly crazy place. You see the birth of a child and you see this whole family full of joy. And on the same floor, you might see someone who has lost their loved ones. Or you have seen someone who has just received the news that they have got cancer. As doctors, you learn to sympathize and empathize, but at the same time stay like emotionally distant from all of this. And that I think is the hardest part too. But as the new generation of India is coming with the kind of globalization we already have seen, people have realized that taking care of yourself, if you are having the means to do so, is actually a good thing. So the newer generations of India don't really carry that emotional load and kind of generational load of saying कि भगवान ने तो यही चाहा है. They are going out, they are earning their money, and they are learning to improve what they can improve. Hope that small little placement of hand, a small little hug, a small little मैं हूँ ना, don't worry, it goes a long way. So if you or any of your loved ones are in that sort of situation where you are dealing with a trauma, ask them.
Some scars are visible, some are not, but every scar tells a story of pain, of survival, and of becoming whole again. Our guest today, Dr. Mrunmayee Dabholkar, is a plastic and reconstructive surgeon who mends not just what was broken, but restores what was lost. From burn injuries to cancer reconstruction, from trauma to gender realignment, her work is a bridge between medicine and meaning. In a world that is obsessed with appearances, she reminds us that healing runs deeper than skin. It's about dignity, it's about identity, it's about the quiet power of renewal. Because as Dr. Mrunmayee shows us, that healing is not just medicine, it is dignity rebuilt one scar at a time. Hi everyone, so let's welcome Dr. Mrunmayee Dabholkar on our show today. Hi Mrunmayee, how are you? Welcome to the show.
I'm good. I'm good. Thank you so much for inviting me on your show, dear.
Thank you. Thanks so much. We really look forward to learning so much from you. So, before we begin, if you could give a very brief introduction to all our viewers today.
Hello, Neha. I'm so honored to be on the show with you. I'm Dr. Mrunmayee Dabholkar Jha. I've done my training in surgery from Nagpur and then plastic surgery from Mumbai, followed by a pediatric plastic surgery fellowship in Mumbai. I'm currently a consultant plastic surgeon in Bhopal, MP, India. And I am very keen into all sorts of plastic surgery, including reconstructive as well as aesthetic practice.
Great. Thank you so much. Welcome again.
Thank you.
The questions that we have today, they are different because they don't just touch upon the physical external transformation that you have done for so many patients of yours, but also like the deep emotional aspect, and touching their mind and identity. So my first question is actually based on that. When we talk about transformation, when we talk about reconstructive surgery, I believe it's not just physical transformation, but there are those invisible scars, those deep emotional scars that are there. And my question is that how do you as a doctor hold space for both? How does your work touch upon the mind identity of a person who is going through this healing journey?
Okay, so a scar is actually a very personal thing. So something as something like a C-section scar, you go through motherhood, you go through pregnancy. Some people take a great pride in it, so they actually like their scars. They actually are kind of it's like an honor. Like I went through this, and now I become a mother. And some people might not enjoy that procedure that much, or something as simple as a pimple scar, which you think is not such a big deal, but it reminds that patient of maybe years of sort of bullying in high school or college. So scars, it doesn't matter whether it is a subject, or objectively how good or bad it looks, but subjectively what that person is reminded, whether it is an emotional trauma, whether it is a physical trauma, because of that scar. So you cannot always judge, this is not so important, why do you want to get this corrected?
It is not the physical, it is the memory of that emotional or physical or whatever trauma they have suffered, because that scar reminds them. So it might not be a very important scar as a doctor or as a physician. It might not seem so important, or it might look great. It has healed well. It has not left such a bad mark. But for that patient, that scar is important. Similarly, it goes the other way around also. Sometimes there are scars which you wear like a badge of honor. Ki, yeah, I survived something. Especially you will see this in patients of breast cancer. They will wear it like a pride, like a honor, that I survived. Oh, I survived cancer, and this is like a memory of that. So scars are very difficult. It's a very subjective how you deal or how the patient deals with the scar. So when you're treating a scar, you are not just treating the physical aspect. You're treating that emotional baggage which they have been carrying for a long time.
Understood. Yeah, you've put it across very beautifully. I want to know like about India as a society, right? We often think that we should endure things, right? Live with it. We celebrate endurance as opposed to healing. But I want to know from you, since you are now in the space of reconstructive surgery, has there been a shift in perspective, especially in the last few years? If yes, then what do you see on the ground now?
So I think endurance was kind of a mantra given to a previous generation, because maybe they did not have the means to deal with it. So even if you had a scar, even if you had a disease, because it was monetarily not possible, or they were living far away, and it was not possible to get it treated, the mantra passed down by generations was deal with it, live with it. That's what God intended. But as the new generation of India is coming with a kind of globalization we already are seeing, people have realized that taking care of yourself, if you are having the means to do so, is actually a good thing. So the newer generations of India don't really carry that emotional load and a kind of generational load of saying कि भगवान ने तो यही चाहा है. They are going out, they are earning their money, and they are learning to improve what they can improve. Now, this can involve a lot of things. Simple things like learning to dress better, going to the gym, taking care of yourself, your health. These are now accessible to general, middle class, even lower class Indians. Even things like Ayushman Bharat scheme, which is a government-run scheme in healthcare, makes healthcare pretty affordable to people who were not not having access to it a few years back. So I think that slowly that mantra of live with it, endure what has been put onto your life, has slightly changed now, and now people are learning to actually deal with the kind of trauma they are inflicted.
Okay, so you have worked with patients who have been victims of burn injuries, right? And that would have been a very painful process, obviously, for them, but also for you, like throughout their healing journey. So, do you have any stories that you can share with the viewers today of any powerful transformations that you've been a part of?
There is one story, but it is quite not a very nice story. So one of the first encounters of burns which I had was during my training in internship.
Okay.
And it was this very young girl, was just 10 years old. And whatever injury she had, there was some family dispute. And in that family dispute, she got burned. And she was very severely burned. She is, I think, one of those patients where I realized how endurance matters. She really took in all the pain. She was very young to actually bear so much, but she did. And we were pretty sure that she would not survive, but she kind of fought against all odds and she survived. She's still in touch with me sometimes. Oh, she was in Goa and now I have moved to Bhopal, pretty far away. But the last I heard that she's doing well, she has graduated. She is trying to complete her studies. As usual, marriage becomes a very kind of difficult thing for these patients. They have had multiple surgeries, they have had a lot of scars, a lot of trauma.
Yeah.
But I always tell her that forget about everybody else, just focus on yourself. And I think she has taken it in her stride. So she's working, she's earning, she's keeping her life stable. And I'm not really sure how her emotional well being managed to survive so many years of traumas and surgeries. But whenever I see a burns patient, I always say, I hope God gives this patient the same strength he gave that little girl to kind of endure.
Yeah. And we cannot even imagine the kind of pain that they would have gone through. I also want to, understand from you that, in these cases, how much time does it take for them to kind of heal? I don't know. I don't know if it's a complete healing, but is it a matter of months or years?
So in plastic surgery, we have a saying that once a births patient, always a births patient. So there are cases where you have a very superficial injury and literally leaves a scarless kind of treatment. But there is always a chance, especially in young children, because they are growing and their skin needs to grow with them. So if you have not completed your growth, if you have sustained a burn injury as a child, which is very common, especially with kitten injuries, with sort of electrical socket injuries, there is a lot of trauma, not just the child endures, but also the parents endure, to kind of confirm and to see to it that this child is rehabilitated into society. So there is a long range. So there are certain very, very, very lucky patients who kind of complete healing within a year or so. But then there are these sort of extreme cases, which is 60% burns, 50% burns, more than that. And they survive into adulthood and they are dealing with a continuous sort of repetitive surgeries, a little tightness in the skin, a little laser treatment here, a little softening required. So they kind of keep coming in and out of OPDs and surgical procedures. So the saying always remains that once a burns patient, always a burns patient.
So you have been a part of many cancer reconstructive surgeries and also gender realignment surgeries. So I want to know from you, do you have any stories, any powerful stories of transformation that you can share with the viewers today?
Okay, so the transgender community in India is actually a very large, very, very strong community.
Yeah.
And though they may look standoffish, they are actually very sweet people. And I deal with them on a daily basis almost. They are kind of troubled souls. Many of them have very sad backstories as to why they were abandoned by their birth families and how they have landed up in this community.
Yeah.
And this community has not just taken them in, they have given them education, they have given them livelihood. So yes, they have a strong connection with the community itself. When you learn their individual stories, you feel a little bad. You hear about small kids who are abandoned by their birth parents because they were having a defect.
Yeah.
Or they were not able to become like a complete boy or a complete girl according to the parents. Sometimes a little bit of religious persecution.
Yeah.
But now they are surviving, they are thriving, they have a livelihood, they have a voice, and they have a very strong community who supports them in sickness and in health. So in that way, they have come out as survivors, and they are a very close knit and a very sweet community.
Yeah. Yeah, you very well said. They have actually gone through a lot. And I think there's also a constant struggle for them, during this journey. And I think when we talk about Indian healthcare ecosystem in general, they face a lot of challenges and struggles, even, on that aspect. So, speaking about the Indian healthcare system, I think that the access to reconstructive surgery in smaller towns is still very limited, right? I want to know from you what, according to you, are some of the infrastructural gaps, some policies that need to be addressed so that there is more accessibility and more information or for the community at large.
So I have to say this actually, according to me, the Indian healthcare is quite good. Right now, there are a whole plethora of not just public but private hospitals as well as government funded hospitals. So in India, there is a scheme called Ayushman Bharat, which is giving free healthcare to almost every senior citizen and anybody who is below the poverty line. Accessibility, yes, does become a problem, but not in the tier 2, tier 3 cities at all, maybe in remote villages. And that also is being tackled by free health checkups, free health camps. But yes, as you rightly said, there are always lacunae in any system. And given the fact that it is a very large, a very diverse population, it does become a little difficult to provide healthcare in every nook and corner of the country. But yes, there are schemes, there are awareness drives happening, and slowly and steadily, I think India can become a kind of a healthcare system where everybody is included and not just the one who have the means to access the healthcare system.
Okay. So you were speaking about Ayushman Bharat, right? For the benefit of everybody, if you could elaborate a little bit more about that, like what's that about, what schemes and what benefits are there?
Ayushman Bharat is like a public-private partnership.
Okay.
So initially, a few years back, it was a very clear division that you would get free healthcare in government hospitals and you would get paid healthcare in private hospitals. But because of this newly generated scheme, a person who might not want to be going to a government hospital or might not be comfortable with a government hospital and can go to a private hospital, use this card which is made, and then this can be helped in private hospitals by some government funds. So I think the scheme is 5 lakh rupees an annum, depending on what age group and what financial means of the patients are. It has done two things. One, it has decreased the immense load on the government hospitals. So there is a certain amount of diversification happening. At the same time, it has made affordable healthcare accessible to a much larger population at large. So it has kind of tackled it both ways, decrease the kind of load on the government services, at the same time made healthcare more accessible to the general population. So I'm not saying it's perfect, it's far from perfect, but it's a step in the right direction.
Absolutely, absolutely. And thanks for explaining that for everybody's benefit. I want to know from you, how do you see India 10 years from now? When you talk about reconstructive surgery. So for your particular, in your particular field, how do you see things shaping up?
So reconstructive surgery is not really a one-man army. It is literally a huge team which goes into it, including the cancer surgeon, the oncologist, the radiation therapist, the plastic surgeon, speech therapy, physiotherapy, a lot of other things. What I would like to see 10 years down the road, and hopefully I will be able to see it. I'm still a very, very young plastic surgeon by Indian standards. I would like to see not just patients recovering from their disease of cancer, but rehabilitating back into society, going back to their jobs, back to earning a livelihood. And I sincerely hope that seeing the kind of cancers, especially mouth cancers, just so rampant in India, I hope the next generation kind of fits tobacco at large, because that is the biggest, the biggest healthcare hazard in today's world is tobacco in any form, whether it is smoking, whether it is eating tobacco, that is chewing tobacco, any form. It is the biggest health hazard. And not just India, I think in a lot of Southeast Asian countries, it is a bad thing. And I hope that the next generations kind of stay away from it as far as possible.
Great. Now I want to talk about your profession. Okay, so as a doctor, personal, growth, and from that personal perspective, what do you think is, some of the, challenges, I would say, or the hardest part of your job, actually? And also I want to know, like, personally, how have you grown over the years?
I cannot generalize this, but I feel that most surgeons have become industrialized. We have become so used to the kind of chaos we endure that we miss it if it's not there. And I think that is a part of our growth process. We are trained from day one to kind of endure it, in not in the sense of it's not a suffering according to me, but you see a lot of things in a hospital. A hospital is a slightly crazy place. You'll see the birth of a child and you see this whole family full of joy. And on the same floor, you might see someone who has lost their loved ones, or you have seen someone who has just received the news that they have got cancer, or someone who has just suffered a very bad accident. And it is like an amalgamation of joy and horror and sadness together. And as doctors, you learn to sympathize and empathize, but at the same time stay like emotionally distant from all of this. And that, I think, is the hardest part, to sympathize with somebody, to understand their difficulties and their sufferings, at the same time kind of distance yourself and not get emotionally involved in it. And I think that sort of balance is what is one of the most difficult part of being a doctor.
Wow, that's such a beautiful summation, right? So, after cancer surgeries, particularly mastectomies, that is also a very difficult part, because it's not just about vanity anymore; it's about wholeness. So, I want to know that how do you, as a doctor, help these women regain their confidence in this journey?
So breast surgery is actually one of my passions. I feel that as a woman, most of the female patients are more comfortable having a female surgeon, because breast is not something you might want to share with uh, the opposite gender. It comes with the layers of shame and layers of privacy. Not just mastectomies, a lot of other breast issues like small lump in the breast, uh, too small a breast, too heavy a breast, all these things are tackled. Uh, the problem with India is the accessibility might be there for the family, but not always for the lady of the house. So, because it takes time for the lady to kind of let everyone know that this is something she's suffering from, because usually it's a hidden thing. I'm hoping that more female surgeons enter this field, and females are more open and have more access to healthcare, and have someone they can openly share these sort of anomalies with, that and suffering from a breast issue or a gynecological issue, and it is more easier for them. They do not feel any shame or embarrassment in sharing it with their doctors. So I hope that more and more females join this particular field. That will really help in spreading that accessibility to the almost 50% of the Indian population.
Yeah. And personally, what kind of, how have you grown personally over the years? Like when you first thought, okay, this is what I choose as a profession, and today, how has that personal growth been?
Actually, maybe I'm really blessed. I think of myself as blessed, because as a very small child, I always thought that that's what I wanted to do. And somehow I have got the right sort of support and the right sort of guidance to not just become a doctor, but to become a plastic surgeon, which I think a lot of my teachers, a lot of my gurus have guided me in that sort of journey, to say this is what is to be done and this is what is to be avoided. And not just in the sense of surgical skills, but skills which you learn in life, how to deal with a certain situation. And I really am truly grateful to the kind of gurus and the teachers I have had, and my parents, of course, and my husband, who has given me that sort of freedom to try to grow as an individual in this field. And I truly feel that, I am not saying everybody goes through such a blessed journey, and there are struggles, no doubt about it. But when I look back, I do feel that I'm very happy with the way things have turned out. And I'm sure the 10-year-old Mrunmayee must be very proud of what the 40-year-old Mrunmayee has become.
Yeah. Absolutely. I mean, having that kind of support system is so important for women. And I'm really glad to hear that your journey has been so fruitful. There's one question that comes to my mind. You were earlier speaking about so many emotional things happening, like you see a trauma victim, but at the same time you're seeing somebody who is celebrating something. So I want to know, like, from the mental health perspective, for yourself, what do you do? How do you maintain the calm and the balance? I know you are a sort of a calm person, but I'm sure you have some practices or something that you kind of resort to.
And I don't know, sometimes there is here you have this sort of a silver lining and you kind of hold on to it. So I always remember this one patient who was a cancer survivor. We operated on him. He was 80-year-old gentleman. He went, he got discharged. So when he was about to go home, his very sweet 75-year-old wife, he removed a 20 rupees from her wallet and she gave me and said, "Ki chocolate le lena apne liye." And of course, I was very young back then.
Yeah.
But that sort of small win. Because I did not operate on him. I was just a resident at that time. I used to do his dressings. But for her, that small favor, and that was her way of saying thank you. So there are a lot of these small moments which kind of make feel that yes, I am in the right profession. I am healing somebody. I'm touching somebody's life, and I might not always remember that person, but that small little gesture will always stay with me. So I'm not saying every patient is always going to take a very good point of view back, but that small little gesture always stays with me. This was almost 10 years back, but I'll always remember it. I still have that 20 rupee.
Wonderful. It's such a beautiful story, right? It always kind of tells you that, yeah, you are doing the right thing. You're in the right profession. Great. And before we wrap up, I have two things. So first is, do you have any message, any advice to those people who are struggling, with any kind of scars? Could it be it could be like cancer related injury or any sort of burn, whatever it is in their life, physical, emotional scars. So what do you have to say to them, how they can hold on to whatever hope they have in their life?
So any person who is struggling with this sort of healing has to come to terms with the fact that it's not just the physical healing, but also the emotional healing. And if you do get a chance, do connect, do try. There's always someone who's going to help you out. There's always somewhere it should be within your means. And it is easier to get help and ask for help rather than try to do it all alone. That small little hope, that small little placement of hand, a small little hug, a small little "main hoon na, don't worry," goes a long way. So if you or any of your loved ones are in that sort of situation where you're dealing with a trauma, ask for help. And always be ready that if somebody does ask you for help, you might not be able to give them any monetary aid, but at least you can give them the emotional support that, yes, I am available. And that goes a long way in the healing journey.
Oh, that's so true. And my final question is that before you get into like the surgery room, right, the OT, you need to be like very well balanced and like calm, and there's a lot of precision which is required, right? Do you have like any personal practice or anything that you do like before you get into the OT or before any like big day?
I I am very energized and I wear scarves. So I have this even I might be very tired, it might be 2 in the night, but when I get a call and when I'm into OT, there is this surge of energy which I always feel is maybe a higher power helping me out. I don't know. But there's always this surge of, yes, this is it. This is what I was trained for. And that helps. That really helps in the sense of you get this sort of divine intervention, maybe, where you feel that all the energy has come back and now I'm ready to face this challenge. and I have a clear mind for some reason, and it helps. It really helps when you are going into an OT tired after a whole day's work, or tired because your kid has not eaten well. When you go over that room, when you put on your gloves, when you put on your scrubs, you are nobody. You are just the surgeon and your hands, and hoping that the divine intervention is coming through my hands and helping the patient in front of me. That is all I'm hoping.
Wow. When you were speaking, all I could see is your passion towards your work and how seriously you take it, and it's so sacred for you, right? Great. The last thing that I want to talk about is how can people connect with you? So if somebody wants to reach out to you, is there any contact details or any Insta ID?
I give the contact details. I think the Insta ID is MJ_aesthetics DPN.
Okay.
That's the Insta ID, but I'll send you the details and you can.
Yeah, sure. We can link it.
Yeah,
Thanks. Thanks so much, Mrunmayee. Thank you for joining and sharing your journey, because you have spoken from your heart, and I could, like I said earlier, I could feel the passion, and I really hope that this inspires people who want to take this up as a profession, or who are currently dealing with any kind of emotional, physical battle, to hold on to whatever hope that they have. So thank you so much for joining us today and sharing.
Thank you also for having me. It was a pleasure on my end to be on your show.
Thank you. Thank you so much for watching us till the end. I really hope that you found value in today's conversation. Please do like, subscribe, comment, and share this with someone who needs to hear this. I always believe that you do not have to look far for inspiration, because there are so many incredibly inspiring stories all around us. Because as they say, that no one else sees the world the way you do, so no one else can tell the stories that you have. Thank you.